I'm Balazs Halmos. I'm a medical oncologist at Albert Einstein College of Medicine, Montefiore in the Bronx, New York. And so exciting to be here in Chicago. There's just so much data that we've seen the last couple of days. And I think it just underlines the importance of events such as the Oncology Brothers live events where this information can be digested, processed, and you can figure out how to utilize the data for your community practice, when you go home. I think the importance cannot be emphasized any more than that. And again, at this ASCO, we've learned so much, and I might just pick out four key pieces of information, that might have been the biggest highlights of the event for me. And let's start with the CROWN study data. The CROWN study was presented with an update this year. The CROWN study, of course, you guys will remember, is for ALK-positive patients with advanced non-small cell lung cancer, comparing the next generation inhibitor, lorlatinib, with crizotinib. And of course, we knew that the study is positive. We knew that the study is very positive, but we did not realize that we could see a study in thoracic oncology where the progression-free survival of patients on the lorlatinib arm is more than 5 years. That's 5 years on one drug that you start your patient on. That is just unbelievable. So it's really just a transformational presentation in a way with that level of excitement. And I think it really emphasizes now the importance of maybe we have to think twice about what is the best agent up front for patients with ALK-positive non-small cell lung cancer. We have a number of choices. Lorlatinib appears truly superior when it comes to efficacy, CNS efficacy. Yes, it does have some unique toxicity issues that we have to learn how to manage in clinic, but it does appear to me that with this presentation, it will be hard not to believe that should be the right drug for many of your patients with ALK-positive lung cancer frontline. And then we can follow up, with a little surprise, and that surprise came from the Paloma-3 presentation, not comparing, IV amivantamab versus sub-Q amivantamab in that particular study. And what we've learned is that the sub-Q version is, first of all, safer than the IV version. No surprise, less infusion reactions, and also, fortunately, we're seeing less thromboembolic events as well. So it reduces the toxicity profile. It can be more conveniently administered. And top of that, and this came as a huge surprise, it appears potentially more effective than the IV version, actually translating into an overall survival benefit, which I don't think any of us anticipated. I don't think the mechanism we fully understand, but at the same time, why don't we just take the extra gift? So in essence, as the sub-Q version becomes available, I think it will be widely utilized, making it a lot more practical and effective, for your patient, where the regimen might be appropriate with chemotherapy or with lazertinib, dependent on the different contexts. And now maybe we can switch focus to the plenary session, the ASCO plenary session, where we had actually three major, highlight presentations focusing on lung cancer. But let me just focus on two that have therapeutic relevance. And one of them is, of course, the results of the LAURA study. We've seen a press release a couple of months ago demonstrating a benefit to osimertinib versus placebo in the context of patients with unresectable stage 3 non-small cell lung cancer with an EGFR mutation. Everybody knew that there will be a progression-free survival benefit, obviously, after we've seen ADAURA, after we've seen FLAURA. But at the same time, still, when we look at those progression-free survival curves with a hazard ratio of 0.16, again, just incredible, progress for our field. So now, finally, we can use osimertinib across, the entire spectrum from stage 1B, to metastatic disease with great success. Again, incredible presentation, standing ovation. And lastly, I think, what was the most transformational presentation for this ASCO was the Adriatic study. Now incorporating immunotherapy into a limited stage small cell lung cancer context, offering patients durvalumab versus placebo after the receipt of concurrent chemoradiation. We've known about the benefit of immunotherapy for extensive stage small cell lung cancer, but that benefit appeared very modest. So we didn't really know what to expect from Adriatic. And I have to say that the Adriatic study results are a lot more impressive than I personally expected, and with a significant progression-free and already an overall survival benefit with a hazard ratio of 0.75 or so, and really demonstrating a major impact without any unexpected toxicities, basically transforming our standard of care of tomorrow. When I go back to my clinic, tomorrow morning, I have to think about offering that to our patients. The drug is available. We have very high level data supporting of its use. So that was a major highlight. Second standing ovation yesterday. So ASCO plenary brought a lot, to our lung cancer community.